Hello everyone, I'm Dr. Abha Mahashur, Consultant Pulmonologist at Lilavati Hospital and Research Center. Happy Women's Day to everyone. Today, I'm going to discuss a very important topic, which is COPD and women's health. So first, let's understand what is COPD, chronic obstructive pulmonary disease, which means that our airway undergoes inflammation and swelling, because of which it is difficult for the air to pass through. Symptoms of this disease are typically breathing difficulty, phlegm production, cough and wheezing. It is typically because of exposure on a long-term basis to irritating gases and exposure to particulate matter. Most often, cigarette smoke is the culprit. These patients go through episodes of worsening wherein they have to go through symptoms which are much worse in their day-to-day variation, and these episodes are called exacerbation. This disease is indeed disabling, progressive and is known to kill. So it's extremely important for us to understand that how does this impact women. Women are special and so is the disease in women. So for us to understand the impact, we need to know certain interesting facts which I'm going to tell you today. With the same amount of exposure, female body can go through the disease much faster and the progression is also much fast. So we have to be careful. Women are much more symptomatic. We are bound to have breathing difficulty, extreme fatigue and weakness, because of which the diagnosis most often in ladies gets delayed, and by the time they come to us, the disease is advanced. Females are known to have the complications of COPD much often, like anxiety, depression, osteoporosis, heart ailments, and so it is a dreaded form of disease in us. Also, women are known to have more amount of exacerbation episodes which takes them to hospital now and again, which again becomes a financial burden, emotional burden and physical burden. So we all need to be extremely careful with this disease. With the same amount of brunt we give to the body, we are going to face much more. Now let's understand the exposures. So why we get COPD? Either it is because of the biomass fuel exposure, which in simple terms is when in our developing countries we do cooking in poorly ventilated areas and we use coal or wood for heating purposes, there is generation of particulate matter indoors which on inhaling gives us the disease called COPD. Presently, with the stark rise in smoking, we don't even need biomass fuel because we are doing enough harm to our airways. Tobacco use, tobacco consumption in any form, be it cigarette smoke, be it chulha, be it hookah, BDs, vaping in our current sophisticated generation, or electronic cigarettes, they are all equally poisonous to our airway. So we need to refrain from that. It is a preventable disease. Of course we can prevent it if we refrain from smoking. That stands the mainstay of prevention of this disease. We need to understand the psyche. Women don't do anything without thinking. So on our discussion, what we have come out is either it's because of the status symbol or it's because of the social involvement which they want. There is a lot of peer pressure. If people around them are smoking, they want to smoke. Young girls, adolescents, middle-aged, elderly, who is left? Everyone is getting more and more attracted towards smoking, and this is not good for us. So on the occasion of Women's Day, I would like to say to all the women that you don't need a puff of cigarette to prove your substance to the world. You don't need to smoke to tackle your mental health issues. We are much more stronger than this. So stay away from smoking and stay healthy. Thank you.